For more anatomy videos, please subscribe to my channel Learn Anatomy with Dr. Tanya Hashik. Hello everyone. In this video, we will discuss the anatomy of spleen. So, spleen, it is a wedge-shaped organ which is located in between the fundus of stomach and the diaphragm. So, it is located mainly in the right hypochondriac area and partly in the epigastric area. That is the abdomen. It is divided into 9 areas. So, which all are they? First one, it is the right hypochondriac area, and next is the epigastric area, and next one is the left hypochondriac area, and below the epigastric area is the umbilical area, and on either side of umbilical area is the right lumbar and the left lumbar, and below the umbilical is the hypogastric area, and on either side is the right iliac and the left iliac. So the spleen, it occupies the epigastric and the left hypochondriac area of the abdomen. Spleen is highly soft, vascular and dark purple in color. Now we will look into the dimension of spleen. So the average thickness of spleen, it is about 2.5 centimeter. It is about 7.5 centimeter broad and about 12.5 centimeter long in an average human being, although it is variable. And spleen, it is related to the 9th, 10th and also to the 11th rib. Spleen has got 2 ends, 3 borders and 2 surfaces. The 2 ends are the anterior end and the posterior end. The 3 borders are the superior border, intermediate border and the inferior border. And the 2 surfaces are the visceral surface and the diaphragmatic surface. And in between the superior and the intermediate border is the hilum. Now we will discuss the peritoneal relations of the spleen. So spleen, it is surrounded by peritoneum and it is suspended by means of peritoneal ligament. And the peritoneal ligaments that suspends the spleen are the lienorenal ligament, the gastrosplenic ligament and the phrenicocholic ligament. The gastrosplenic ligament, it extends from the hilum of the spleen to the greater curvature of the stomach, and the lienorenal ligament, it extends from the hilum of the spleen to the anterior surface of kidney. And the gastrosplenic ligament, it contains the gastric vessels, the lymphatics and also the sympathetic nerves. And the lienorenal ligament, it contains the tail of pancreas, the splenic vessels and also associated lymph nodes. And the phrenicocholic ligament, it is not directly attached to the spleen, but it supports the spleen at the anterior end. Now we will discuss the visceral relations of the spleen. We have already discussed that spleen, it has got both diaphragmatic and the visceral surface, and the visceral surface contains certain impressions which is created by different organs. In this figure you can see that. The first one among that is the gastric impression, which is made by the fundus of the stomach, which is seen in between the superior and the intermediate border. Next one is the renal impression made by the left kidney. It is seen in between the intermediate and inferior border. Next is the colic impression, which is made by the splenic flexure of the colon, and it is a triangular impression which is seen at the anterior end of the spleen. Next one is the pancreatic impression for the tail of the pancreas, which is seen in between the hilum and the colic impression. Now we will discuss the blood supply to the spleen. So the blood supply to the spleen, it is through the splenic artery, which is the largest branch of the celiac trunk, and it reaches the spleen through the lienorenal ligament. At the hilum of the spleen, the splenic artery, it divides into 5 or more branches. We will go in detail about the splenic circulation in another video. Now we will discuss the venous drainage to the spleen. So venous drainage, it is through the splenic vein which is formed at the hilum of the spleen, and it has a straight course behind the pancreas, and at the head of the pancreas it communicates with the superior mesenteric vein and forms the portal vein. Next is the lymphatic drainage of the spleen. Splenic tissue proper do not contain any lymphatic tissues, but a few lymphatics arise from the connective tissue of trabeculae and capsule. In this figure, I have marked it, and it drains into the pancreatico-splenic lymph nodes. That is about the lymphatic supply. Next is the nerve supply to the spleen. Sympathetic nerve supply, it is from the celiac plexus, and the parasympathetic from the vagus. So this is the end of today's video.